Are you taking vitamins simply because you heard they're good for you? After 60, that may not always be the best approach. Are you taking vitamins simply because you heard they're good for you? After 60, that may not always be the best approach. You may have a multivitamin, vitamin D, B, vitamins, calcium, magnesium, or several other supplements sitting in your cabinet. But before adding another bottle to the routine, it's worth understanding what your body actually needs and what may simply be unnecessary. Point 1. Niacin, also known as vitamin B3, is necessary for normal metabolism, but high dose niacin supplements are very different from the amount you naturally get from food. Large doses can cause flushing and may affect the liver, blood sugar, and other aspects of health. If you're considering niacin because you've heard it can improve cholesterol, that's something to discuss with your healthcare professional rather than treating it like an ordinary daily vitamin. Point 2. Folic acid is the supplemental form of folate, a nutrient needed for DNA production and healthy red blood cells. But high-dose supplementation should have a reason behind it. Excessive folic acid can correct the anemia associated with vitamin B12 deficiency, while allowing neurological damage from B12 deficiency to continue unnoticed. If you're considering a high-dose product, especially after 60, discuss it with your healthcare professional. Point 3. Vitamin B6 is another nutrient that deserves caution, especially when it comes from supplements rather than ordinary foods. Your body needs B6 for normal brain function, metabolism, nervous system activity, and the production of neurotransmitters and red blood cells. So this is not a vitamin you should think of as bad. The concern is taking excessive amounts over long periods. High supplemental doses of vitamin B6 can cause nerve problems, including symptoms such as tingling, numbness, or burning sensations in the hands and feet. This can be particularly easy to overlook when you're taking several products at the same time. For example, your multivitamin may already contain B6, while a separate B complex or energy supplement may contain additional amounts before adding another bottle. Check the labels and consider your total daily intake. Point 4. Vitamin A is essential for normal vision, immune function, and healthy cell growth. But high doses of preformed vitamin A from supplements can accumulate in the body and become harmful. This is important because vitamin A isn't something you need to eliminate. Foods can provide vitamin A and related compounds as part of a healthy diet. The concern is unnecessary high-dose supplementation, especially when you're already getting vitamin A from food, fortified products, or a multivitamin. Excessive intake of preformed vitamin A can cause toxicity and has also been associated with concerns involving bone health. After 60, maintaining strong bones becomes increasingly important. So taking a large dose, simply because the bottle promises additional benefits, may not be a wise strategy. Point 5. Vitamin E is often promoted because it acts as an antioxidant, but that doesn't mean taking large amounts automatically gives you greater protection. Your body needs vitamin E, but high-dose supplementation is not recommended, simply as a general strategy for preventing heart disease or cancer. For generally healthy adults, evidence has not shown a clear preventive benefit from vitamin E supplements for these purposes. High supplemental doses may also increase certain risks, including bleeding. That doesn't mean you should avoid vitamin E. Foods such as nuts, seeds, and vegetable oils can provide it naturally. The important distinction is between getting an essential nutrient through a balanced diet and taking a concentrated supplement at a high dose without a specific medical reason. Point 6. Beta-carotene is another example where food and supplements should not be treated as identical. Foods such as carrots, sweet potatoes, and certain leafy vegetables naturally provide beta-carotene, but high dose. Beta-carotene supplements are not recommended for preventing cardiovascular disease or cancer in people who smoke or have certain occupational asbestos exposures. Supplemental beta-carotene can actually increase lung cancer risk, so eating vegetables is not the same thing as taking a concentrated beta-carotene pill. Point 7. Vitamin D is important for calcium absorption and bone health, and some older adults may need supplementation. But taking extremely high doses without medical guidance isn't automatically safer or more effective. Too much vitamin D can cause calcium levels in the blood to become excessively high and may contribute to complications such as kidney problems. The appropriate amount depends on your individual circumstances, diet, health status, and sometimes laboratory testing. Point 8. Iron is necessary for making hemoglobin and transporting oxygen throughout the body. But taking iron without a documented need isn't a harmless habit excess. Iron can cause digestive problems and, in some situations, contribute to harmful iron accumulation. If you're experiencing unexplained tiredness or weakness, don't automatically assume you need iron. Fatigue can have many causes, and a healthcare professional can determine whether iron deficiency is actually present. Point 9. Vitamin C supports collagen production, wound healing, and normal immune function. But extremely high doses aren't necessary for most people. Large amounts from supplements can cause stomach discomfort and diarrhea, and may increase kidney stone risk in susceptible individuals. Fruits and vegetables are excellent sources. So before reaching for a high-dose supplement, consider whether your normal diet already provides enough. Point 10. Calcium is important for maintaining healthy bones, but a calcium supplement isn't automatically necessary for every person. Over 60, many people can get calcium through foods such as dairy products, fortified foods, and other calcium-containing foods. If your diet already provides enough, adding large supplemental doses may not provide additional benefit and can create problems for some people. Consider your total daily intake before adding another calcium product. Point 11. Magnesium supports normal muscle and nerve function, but supplements aren't automatically needed by everyone. Excessive supplemental magnesium can cause diarrhea and may be more concerning when kidney function is impaired. Point 12. Vitamin K is important for normal blood clotting and bone metabolism, but it can interact with medications such as warfarin. If you take a blood thinner, don't suddenly change your vitamin K intake or begin a vitamin K supplement without discussing it with your healthcare professional. Point 13. Vitamin B12 deserves special attention as we get older because some adults may have difficulty absorbing B12 from food. Certain medications, digestive conditions, and dietary patterns can also make inadequate B12 intake more likely. B12 plays an important role in maintaining healthy nerve cells and producing normal red blood cells. When someone is deficient, supplementation can be an important part of correcting the problem, but that doesn't mean every person over 60 automatically needs a high-dose B12 supplement every day. The better approach is to consider why you might need it. If your diet provides little or no B12, or if you have a condition or medication that affects absorption, your healthcare professional may recommend supplementation. In some situations, blood testing can also help determine whether a deficiency is present. And remember, a supplement should be viewed as a way to address a specific nutritional need, not as a guarantee of better health. Simply because the dose is large